Today at FemHealth, we are talking about 10 weird signs of early pregnancy. Let's dive in. Number 1 is dysgeusia. This is the medical name for having a metallic taste in the mouth. Many women describe it as tasting like metal or pennies, or a bitter taste, even if they are not eating. This symptom is believed to result from hormonal changes, particularly increased levels of estrogen and progesterone. This can alter taste perception and increase sensitivity to certain flavors. Some research suggests this could be linked to changes in saliva composition or even an evolutionary protective mechanism against ingesting harmful substances. Though unpleasant, this strange symptom is harmless and usually fades after the first trimester. Some people may find relief with citrus fruits, mint, chewing gum, or switching to non-metallic utensils. Number 2 is extreme fatigue. People often associate fatigue in pregnancy with the later trimesters, but it can happen early. Even before a missed period, many women experience a deep sense of exhaustion that doesn't improve with rest. This fatigue is primarily due to rapidly rising levels of progesterone, a hormone that helps maintain pregnancy, but also acts as a natural sedative. At the same time, the body is working harder to support the growing embryo. This means that your metabolic rate increases, your blood volume rises, and your blood sugar and blood pressure may decrease. These, combined with physical changes, can leave a woman feeling overwhelmingly tired. Fatigue often improves by the second, but then can go up again in the third trimester. Prioritizing rest, eating balanced meals, and staying hydrated can help manage this symptom. Many people often talk about food cravings in pregnancy, but this is not the only sign of a pregnancy. Number 3 is having food aversions. Food aversions can be just as strong. Many women find that foods they once loved suddenly become unappetizing or even nauseating. This is often linked to heightened sensitivity to smell and taste, driven by hormonal changes like increased estrogen. Common triggers include meat, fish, eggs, and strongly flavored or fried foods. These aversions can lead to major shifts in eating habits, and this can make nutrition a challenge. Small, frequent meals and bland or cold foods, which tend to have milder smells, may help manage this symptom. The 4th weird sign of early pregnancy is having vivid dreams or nightmares. This is more commonly reported in the last trimester, but it can happen in the first one also. The hormone progesterone can affect sleep cycles, memory, and emotional processing. Pregnancy often disrupts sleep through frequent waking, discomfort, or needing to urinate, causing more REM sleep interruptions where vivid dreaming occurs. At the same time, the emotional weight of becoming a parent can spark anxiety-based dreams. While unsettling, vivid dreams and nightmares are generally harmless. Journaling dreams and practicing good sleep hygiene can help. Number 5 is having pregnancy rhinitis. Pregnancy rhinitis refers to nasal congestion or a runny nose that occurs without signs of a cold or allergies. This symptom is caused by hormonal changes, especially increased estrogen, and greater blood flow to mucous membranes, including the nasal passages. These changes can cause swelling, dryness, or increased mucus production, making breathing feel more difficult. Rhinitis can start as early as the first trimester and may last throughout pregnancy. Though it's not dangerous, it can disrupt sleep and can make fatigue worse. Staying hydrated, using a humidifier, and saline nasal sprays may provide relief. The 6th weird symptom of early pregnancy is bleeding gums. Bleeding gums are a lesser-known but common symptom during pregnancy. Hormonal shifts can make the gums more sensitive to plaque and prone to inflammation. This is a condition called pregnancy gingivitis. Increased blood volume and enhanced vascularization of gum tissue contribute to swelling and bleeding, especially when brushing or flossing. Though minor bleeding may be normal, it's important to maintain excellent oral hygiene during pregnancy. The 7th symptom of early pregnancy is having mood swings. Mood swings are extremely common during pregnancy, especially in the first trimester because your hormone levels are surging quickly. Estrogen and progesterone can significantly affect neurotransmitters in the brain that regulate mood, such as serotonin and dopamine. Add to that the emotional weight of pregnancy, anxiety, excitement, and uncertainty. And it's easy to see why many pregnant women feel like they're on an emotional roller coaster. One moment may bring tears, the next laughter, and sometimes irritability without a clear cause. These changes are normal, but severe mood swings may indicate underlying anxiety or depression, which should be addressed with professional support. Another weird symptom of early pregnancy is having increased bloating and gas. This is something that we know happens later as the baby can put pressure on the mom's belly, but people do not realize that it can also happen very early in pregnancy. Bloating and gas can begin early in pregnancy, sometimes even before a missed period. Rising progesterone levels slow down the muscles in the digestive tract, including the intestines. This slower digestion can lead to gas buildup, bloating, and discomfort. Additionally, increased water retention and changes in gut microbiota during pregnancy may contribute to these symptoms. For many women, this bloating can feel similar to premenstrual symptoms, but it can last longer or it can be more intense. Eating frequent smaller meals and avoiding gas-producing foods can help. The 9th weird symptom of early pregnancy is having a heightened sense of smell. A heightened sense of smell, or hyperosmia, is frequently reported in early pregnancy and is often one of the first clues that a woman may be expecting. Estrogen is believed to play a key role in amplifying olfactory sensitivity, making everyday smells seem stronger or even overwhelming. While this sensitivity tends to lessen after the first trimester, it can be challenging to manage. Ventilating spaces, using unscented products, or switching to cold foods which emit less aroma may provide some relief. And finally, the 10th weird symptom of early pregnancy is having excess saliva. Excessive saliva production is an unusual but surprisingly common pregnancy symptom. It often begins in the first trimester and may be associated with morning sickness or nausea. Hormonal changes, particularly those affecting the digestive tract, are thought to play a role, and some researchers believe it may be the body's way of protecting the mouth and esophagus from stomach acid during episodes of vomiting. For some women, excess saliva can be so pronounced that they need to spit frequently or carry tissues or a cup. Though it usually subsides by the second trimester, it can be socially uncomfortable. Sucking on lemon drops, drinking water regularly, and brushing your teeth frequently may help manage symptoms. Remember to like and share this video.